I started studying prematurity sort of by accident, like lots of scientists. So when I went to graduate school, I thought that I was going to work on lemurs in Madagascar. And then that sort of didn't work because I kind of found that a little boring. And then I decided that I was going to work on how snake venoms evolve, because snakes are fun. So I got this funding to go out to Arizona and collect snakes. It's just that the year that I went, most of my study sites were on fire because there were a lot of big brush fires in Arizona that year.
Taking women through a pregnancy and delivering a baby was one of the coolest things I'd ever done. And then I discovered maternal fetal medicine, which was this more critical care intensive approach to pregnancy, and it just made complete sense for me.
When I was a medical student, we have rotations, and I couldn't make up my mind what I wanted to do. So the chairman of the department said, you know, Becky, I think that you should rotate through the NICU. And so I did my rotation, and I thought, this is really exciting, and this is where I think I can make a big impact on healthcare.
The center is really this large initiative to bring people who are interested in prematurity together to study new ways to look at how to prevent preterm birth.
This is my dream opportunity in putting together placental biology, preterm birth, and really being able to study as I've really always wanted to.
Creating a transdisciplinary center like this is a brand new way to think about doing science.
When we come together, we come up with very interesting ways of viewing this one problem, prematurity, in ways that we wouldn't have otherwise.
When you add them all up, I think we have over 150 scientists in total working on this. And so what the center to me represents is a whole new kind of researcher coming in.
We have engineers in the room. We have artificial intelligence, robotics people. We have mathematicians. We have epidemiologists such as myself. We have neonatologists. All these different disciplines with their own languages starting to really think about how can we solve this problem.
It's such an important problem. 500,000 children in the United States are born prematurely. They have long-term disabilities from it.
Well, preterm birth is just such a major public health burden, and with huge emotional and financial impact on families.
Preterm birth is a major public health issue, given the number of babies that are born preterm in this country every year and the cost of caring for preterm infants over their lifetime.
I see what prematurity has done to children and families. To be able to say I've impacted on that in some small or hopefully large way would be the most satisfying thing I could think of doing in my career.
You know, it's really quite gratifying to be able to think that maybe, just maybe, you'll be able to make a difference.
The hope is that we'll come up with some really interesting, important, previously ignored factors and mechanisms and approaches and interventions that can improve upon this problem.
At the end of the day, you know, I'm a doctor and I see patients, and I see women who've had preterm births, who've lost babies, and I want to help them. And I think the way to do that is really by doing great research that impacts how we take care of patients, and that's what these centers are ultimately about.